Suddenly singing in church went from being the most benign thing you could possibly do
To the
a
most
very dangerous thing.
Hello, welcome to the Dr. Gill Show. This is where we talk about medical matters that matter to you. My guest today is Dr. Timothy Gulden. Welcome to the show, Tim.
It's great to be here. Thanks.
Tim is a PhD. He's a real doctor.
Hardly. Fun.
A FUD with a degree in public policy from the University of Maryland.
It's true.
I understand one of your professors, you had to defend your dissertation, was a Nobel Prize winner.
Yeah, Tom Schelling won the Nobel Prize in 2005, the year after I defended my dissertation, making me instantly smarter than I was the day before. Instead of winning the Nobel Prize, the great thing about it is how happy it makes all of your friends. He was unhappy that it largely unretired him.
Fantastic. And you might be wondering, why am I interviewing a public policy expert on a medical show? And it turns out public policy and decision-making involves health policy in very broad, deep ways, doesn't it?
It does.
Affects all of us.
Yep.
Now, I'm going to backtrack a little bit, Tim. We are at our annual Rocky Mountain ski retreat.
Mm-hmm.
And it's wonderful skiing with you here in this beautiful environment. We're about 8,000 feet, and we probably haven't shaved in a long time.
It's true.
So if we look a little scruffy like mountain men, that's the explanation for that. Tim is also my brother-in-law. In full disclosure, he's in my family as well. So if I hit him with softball questions, that's my explanations. Now, Tim, you, I believe, are a senior policy analyst at the RAND Corporation.
That is true, yes.
RAND, I think, stands for Research and Development.
It does, though it's been a long time since it's really done development. We do research, but that is where it came from, yeah.
And RAND is one of the preeminent think tanks in the world. And what I want to talk about a lot during this interview is, what is a think tank, Tim?
Yeah, well, that's a fascinating topic, because that word gets used in two really quite different ways. Two different kinds of institutions, both important, get referred to as think tanks. And the one that maybe people are most familiar with are places like Heritage, AEI, American Enterprise Institute, Cato. There are a whole host of Washington think tanks.
Are Brookings in there?
Brookings straddles the two meanings, but you could consider it one of those. I'm not sure how I'd classify Brookings.
Interesting.
But the idea of the political think tanks is to take political kind of ideologies, and maybe AEI is all about free enterprise. Heritage is kind of American conservatism. Cato is really kind of libertarian ideas. So how do you take those big ideas and translate them into laws and policies that could actually be implemented?
Interesting.
And so those think tanks come in with a point of view.
An agenda, is it?
They're about translating an agenda into policy. And of course, that's an important part of the American democracy. There's nothing wrong with that.
Sure.
But it's quite different from what RAND does. And there's RAND, there's MITRE, there are a number of think tanks that do nonpartisan, objective policy research. So we're a large nonprofit. We work mostly for the government. And our work is scrupulously nonpartisan. And so the government comes to us, so as we come to the government saying, hey, you should ask us about this, but somehow or other they come to us with questions, and we do really careful research, grounded in facts, to help government decision makers decide what to do. I mean, what is the right thing to do here? What's the state-of-the-art thinking on something?
These are frightfully difficult questions, aren't they?
We only work on essentially impossible questions.
Or in the skeet parlance, only double black diamond.
Only double black diamond.
For RAND. I let the beginners can do the green stuff.
Exactly. If there's a clear right answer, if the question's well defined and there's a right answer to it, there are lots of consultants that can do that. There are lots of people in the government that can do that. There are lots of smart people out there that can do things competently.
Right.
The RAND hard questions are the ones where the policy person comes to us and says, I'm not even sure quite what to ask you. And we end up half of the project is figuring out how to define the question in such a way that we can actually answer it in a way that is objective and useful.
Like, I assume Congress can pass a law, and it seems like common sense, right? But how do you where does the rubber hit the road?
That can be a real challenge. How do you design the regulations that actually implement a law? And that there's a lot of wiggle room in there, and some of that wiggle, I mean, the interpretation is required. At some point, you're interpreting it to the point where you're not following the law. You don't want to do that. You have to actually analyze the law. What is it that they asked you to do, and how can you interpret that in a way that is true to what Congress asked, but actually also, is implementable, actually works.
Yeah, it's like engineering. You may know all the math, but can you actually design a plane that flies, right?
That's right. Yeah, and that takes a certain amount of experience. And RAND has probably about 1,200 full-time researchers, and then another probably close to 1,000 support staff. Probably about 60% of those people have a PhD. The ones that don't have a PhD, most of them have a master's degree. But also, most of the ones that don't have a PhD, were once the ambassador to somewhere, or were a general. These are people with something better than a PhD. They've really proven that they can do real work in the world. So it's a pretty deep bench of people with expertise in a lot of different areas.
Wow. So it's a brain trust, a place where you can get a lot of experience, a lot of intelligence, and a lot of hard work. Now, Tim, we are eventually going to get to some public policy and some health issues, but I want to talk about some stuff that just fascinates me. I believe Rand Corporation was a spinoff of an airplane company in the Air Force, Con Air or something.
Yeah, the Air Force really stood up Rand in, the 50s.
And didn't it start right after World War II?
It was shortly after World War II, yeah. And the Air Force realized that they didn't have the expertise, in the ranks to do the really difficult engineering, to address the big questions. The actual people in the Air Force were too young. They were about doing things. They weren't about looking way over the horizon.
And weren't they also worried about losing a lot of the expertise? A lot of these scientists in World War II, they were dispersing.
They're going off into different companies, potentially different countries. But everybody had been focused on the war effort,
Manhattan Project,
and that focus was going all over the place. And they realized also that during the war, the interests of the airplane companies and the interests of the U.S. government, everyone was focused on winning the war.
Okay.
So everybody's interests were aligned. Once the war was over, the airplane companies were trying to make money. And the government they wanted commerce to work, but it had other things it wanted to do too. They found that they couldn't get necessarily objective answers from the airplane companies anymore, because the airplane companies now had an interest that wasn't aligned with the government's interest. It was slightly different. So it made sense to spin off an independent entity that was full of engineering and other related expertise, but that actually didn't have a conflict of interest with the corporate aircraft companies.
So they
could work closely with them, but actually not be beholden to them. And so that was the origin of the think tank.
Interesting. So give me some idea of the range of policy questions you might be asked, and who might be asking these questions of Rand.
Yeah, I can kind of sketch the broad organizational structure of Rand. I'll give you some idea. So the origin was with Project Air Force. It was all about advising the Air Force. And then the other services started saying, hey, what? We need some of that. So there's the Air Force Division, there's the Army Division, Project Arroyo. There's one that works generally across the Department of Defense. There's some other specialist think tanks that actually are at other specialist federally funded research and development corporations that are hosted by other think tanks. But so we've got Army, Air Force, DoD in general, and Homeland Security is the newest unit. That's where I do most of my work. There's a special kind of government contract, a federally funded research and development corporation that are those four. But then there's also Rand Education that does mostly grant-funded education work.
So you have a PhD program. You're actually, is it a university or is it?
I'll get to that in just a second. We also have a health program, which we'll talk about more. We have social and economic well-being and justice and infrastructure.
Yeah.
There's a lot of police and public safety stuff. So we got all these different areas. And we do also, as you say, we have a graduate school that's actually the the largest public policy PhD program in the country. We produce about 25 public policy PhDs per year. People coming in from actually all over the world, probably about half US citizens and half people from elsewhere who are going to go on to be government elites in other countries.
Oh, what an important network to have
It really is
in the global world.
It's a powerful tool for, it helps America. It's great to have the decision makers in particularly developing countries
Know what they're doing.
Well, know what they're doing, and also know what they're doing the way that, we conceive it. Because they could go to China and get a degree. They could go to Russia and get a degree. Right. We would rather that they frame their policy, in a way that has some alignment with the way we frame policy.
And you have to know from the inside out to be able to do that.
So, and an exciting thing about the way that graduate school works is that, there are classes, and I teach one of them, but the main thing that the students are doing is they need to put in, I think it's about 150 days a year of work on RAND projects.
On a real project.
Yeah, we call it OJT, on the job training. And so they are doing statistics, they're doing literature reviews, they're writing pieces of reports. So by the time they finish, 3 to 5 years of work and they finish their dissertation, they've got 3 to 5 years of experience working on a broad range of problems that are, things that they have some expertise in. But they're really a veteran analyst by the time they get their PhD.
Wow. Almost, seems like residency. You're doing the surgeries here and there.
It is modeled largely on medical schools. Yeah, because a lot of the stuff you can textbook it to some extent, but at some point you got to do it. You got to manage the blowback. You got to put the report out there and have people be angry about it and figure out what to do about that. Just the same way a surgeon might have complications, and you got to deal with those complications. And so
work shoulder to shoulder with the experts.
Yep.
As you come up in ranks. So I understand that in order to work in RAND and working on these defense contracts and work with these things, you have to have a security clearance.
Not everyone at RAND has a clearance,
but a lot do.
But many do. Yeah, we do a lot of work that involves looking at sensitive stuff, and some of it's interestingly sensitive. Some of it's kind of the thing that everybody would want to know. A lot of it is actually quite mundane.
It's not sexy at all.
Yeah, what kind of router does this Army base use? Well, you don't want an adversary to know the brand of router because then they know how to exploit it. But on the other hand, who cares? It's not very fun. So, a lot of classified information is very pedantic, just very, very mundane, but it's important. And so, we have the infrastructure and the people to safeguard sensitive government information and make sure that it really never gets compromised and out. And there are special rooms with double fancy door locks.
Are these skids or what are they called?
Skiffs. Yeah, we have MOSIFs and skiffs and we got the JWICS network. We had all kinds of fancy internet variants that are very secure, and it makes it hard to get work done. But it is important to keep this stuff safe.
When you were describing this to me, you'd think you'd be curious. Apparently, if there's something that's compartmentalized, you want to get out of there. You don't even want to know.
You don't want
to run away.
Because the problem is, I can speculate, UFOs, and UFOs it's fun. Well, if I were to ever get read in on a UFO project, I assume there are some, I don't really know, but if I actually had classified information, that probably would be, we don't know what that was. It probably wouldn't be very interesting. But once I was read in on it, I wouldn't be able to talk about it.
Ever.
To
the grave.
I can talk about it now because I don't know anything special. But if I got read in on a UFO project, I have to shut up forever. So I don't want to, unless I can actually do something really useful on that. I don't want to know. And also, I can't go into the classified library and just read stuff. You have to have a need to know.
You need to know.
And so being cleared isn't enough. You need to be cleared, which means you're allowed to know, but then you have to have a need to know, and then you get read in on a project and you dig in and you do the work, and then you present that work to the sponsor, and that is all.
Gotcha. Now I'm going to ask you a question, Tim, and obviously if you can neither confirm nor deny, we have to respect your top secret clearance here. Was there a request to think about what does a pilot do if it encounters a UFO? Is that, can we talk about that?
As I know, that request has not been made. It's not been made to me. I at one point proposed that we should spend some internal money thinking about that. Okay, if we know that we don't know some things, and I don't know exactly what we do and don't know. I mean, I know what we, the general public, know and don't know.
Right.
So given what we, the general public, know and don't know, how can we make good decisions given that level of uncertainty? The idea of decision-making under uncertainty is kind of a Rand thinking framework that we've applied to many things, of water resources and climate change things. Well, we could apply that here. So I had proposed that we spend some internal money doing a decision-making under uncertainty study of unexplained aerial phenomena. And it made the finals of the internal competition for what would get funded, and everybody liked it, but they decided to spend the money on things that the government was more actively interested in. So it would be great if the government would ask that question. We would be happy to answer it. But so far as I know, they have not asked.
I mean, that's a great question. Do you have a pilot, and let's say this happens, right, in a fighter plane, and there's some unexplained object. Do they fire at it, right? Somebody should think about this, so it's not a seat-of-the-pants decision.
You don't want the pilot improvising that decision. That should have been thought through by various stakeholders ahead of time, and they should have clear guidance on, look, if you don't know what you're looking at, but it's complicated. What if the thing they don't know what it is really threatening something? Well, maybe they should shoot at it then. I mean, It's not as simple.
No, it sounds
frighteningly not simple. Yeah.
Frighteningly complex and nuanced. And gee, if something has come light years away, it probably has something to protect itself from bullets, right?
And generally speaking, probably there are simpler explanations than something that came from light years away. But you can't rule it out. You really don't know until you know, and we don't know.
So it deserves some thinking.
It deserves some thinking
in a clear-headed way.
Yeah, clear-headed way. Really a sober, having some sober, careful engineers, political scientists, policy analysts think through, okay, what do we really not know? What policies can we design around this? What guidelines can we give pilots? Also, what kind of systems could we design for reporting? Currently, commercial pilots report weird stuff to the FAA. The FAA doesn't really have a system for tracking it.
Really?
The Air Force, you may or may not report weird stuff to the Air Force. They don't really have a formal system for tracking things that are weird. They have various systems for tracking various things. The general public can call, the police. Well, what do the police do with, I saw some weird stuff?
Right. What have you been drinking?
So it's like, there is no central place where we gather all that information together, which means we don't know as much as we could know, because we don't really have a central repository of unexplained information. So that's the kind of thing that we might design. I say, okay, government, the place to put this would be in the Department of Homeland Security or the FAA or maybe the Air Force. But what's the best place to keep track of this stuff? What do you really need to know? How can you kind of standardize the information you collect so that you can do larger analyses and really figure out what's going on? What do we need to know? What do we really need to know? What's the missing information that we could get? How could we get it? That's the kind of thing that we could help design.
Wow, well, that's a good segue into some public policy. At this point, it's been several years since the COVID pandemic came upon us.
Mm-hmm.
Talk about uncertainty. We didn't know what it was at first.
Yep.
We didn't know how it was transmitted. We didn't know, once we knew it was a virus, we weren't sure how you get it. We weren't sure how immunity worked. We weren't sure if it was engineered. It was just a huge amount of uncertainty. And maybe for our younger viewers, it was a time of great anxiety. Our hospitals were full. They were bringing in refrigerator trucks for the bodies.
Yep.
Our ICUs, our healthcare people. I wasn't involved directly, but I was involved indirectly. Our whole healthcare system was stressed to the max. It was a really stressful situation. And we had the options of some vaccines. Now, it turns out the new vaccines aren't traditional vaccines. They work by a different mechanism, which was a whole new ball of wax.
Yeah, right.
How does a messenger RNA signal differ from an inactivated protein, let's say, to boost the immune system? Two different arms And we didn't know.
Yep.
And there was a great shortage, and we needed vaccines quickly. The decision at the time, which is still probably true, is we needed a lot of vaccines quickly. So there were shortages.
Yeah.
There were shortages of vaccines, Tim. And the thinking, and tell me if I'm wrong, I believe the thinking was we've got to vaccinate the vulnerable, the sick,
right.
and the elderly.
This is
So
very
we're gonna-
intuitively appealing.
Right, that makes sense.
Makes
right?
sense. Yeah.
But you did some thinking. Now, were you actually tasked to think about this? Did the government come to Rand and ask you to for help?
We actually did this. We did this with internal money. We basically the profit we make off of the research we do. We're a nonprofit. We don't get to take that home. So we take.
But you have to pay salaries. You have to pay rent.
Yeah. Well, there's a lot of that. There's all that. But
Cost of business.
There's some money left over after all that stuff. That would be profit. We spend that on questions that the government hasn't asked us yet.
And you knew this was a big one.
Things that are big ones, things that they maybe should ask us, maybe they will ask us, where we need to develop some expertise, where we see an opportunity to contribute. Since we can't keep the money, we spend it to pay each other, to pay ourselves, to do research that seems important and relevant. And so in this case, we actually got an opportunity to get some very sensitive data. We actually got from an advertising tracker. They had data coming from people's cell phones, from things like weather applications and things. Many of the apps you use on your phone actually transmit your location.
They ping,
to advertisers. So this was a consolidator that had gathered up, I think we had 6 billion pings from the Portland, Oregon area. And over the course of, we got 4 months of data, 2 months before lockdown and 2 months after. And we did some very intensive processing of these individual pings to link the same phone and then figure out which phones had come near each other, within 10 meters of each other. And so we could actually, and of course, the potential for abuse of data like this is huge. If there's someone that you know in Portland, you know where they live, well, where does a phone spend the night?
Probably
That's their phone.
That's their phone.
Now, where else do they go?
So Tim, where your phone spends the night indicates where you live usually and who you come in contact with.
Right. So the challenge with this advertiser data, which of course the internet runs on this stuff. You step onto a car lot, you're going to see ads for cars.
Yeah.
You're gonna Google a car
It's spooky.
because your phone ratted you out to the advertising network, and then you start seeing ads for cars. So we got this data, and we actually treated it like it was classified. It wasn't classified, but we gave it the same protections we would give the classified data. And we also worked out elaborate protocols for how to make sure that only the right people were seeing it, the kinds of analysis we would do, the kinds of analysis we wouldn't do.
Is this metadata?
This is metadata. This is saying this phone was at this XY coordinate at this time, and it has an encrypted ID. It's this phone.
Oh wow.
But you have to pay somebody quite a bit to turn that into who that person was.
Okay.
But again, from location, you could figure that out, and you could then track somebody. We had to make sure that could never happen.
Okay, so you just scrub it in a way.
Yeah, we just had to keep it secure.
Okay.
But what we were able to do with it was figure out which phones had come near which phones and actually come up with a contact network. We had data on about 2/3 of the people in Portland. So we actually used about a week of data to collapse down into a single day to kind of come up with a rough idea of each person's movement pattern. And the data there were some limitations to it, but we came up with a contact network where we could then build a computer model of when people come within 10 meters, there's some possibility that they transmit.
Sure.
And so we could actually unfold a pandemic. We could drop a few random infecteds in there and watch the pandemic unfold on this network.
In silico.
And we had 2 months of data before lockdown where people were behaving normally, and then 2 weeks after lockdown. Now, that first part of the lockdown was kind of the most intense, and we could actually mix the two networks to come up with intermediate versions of lockdown.
Wow.
And so we could start to say that, a certain level of lockdown prevents a certain number of cases. We also found that it was very lumpy. The network was had a lot of texture to it. So things would be going along just fine, and nothing would change. Suddenly you'd have a big outbreak, just because it hit. I don't know. It turns out singing, very dangerous.
Part of droplets.
Suddenly singing in church went from being the most benign thing you could possibly do
To
a very dangerous thing. So if you've got a mega church where people go and sing, well, what could be nicer? Well, it turns out super dangerous.
Super dangerous.
So that kind of we could model that kind of stuff. And the thing we found, the policy thing we found, was that by vaccinating the most vulnerable, first of all, they were hard to find, they were hard to vaccinate, they were staying home.
Right.
And the vaccines weren't 100% effective. So by vaccinating grandma, first of all, it was hard to vaccinate grandma. Secondly, you had to get her out to do that. That actually you could save more, and grandma was vulnerable. It was the elderly people, the immune compromised people who were most vulnerable.
So that doesn't change.
That doesn't change. I mean, you could make them a little less vulnerable by vaccinating them. But the way you could really make them less vulnerable was by vaccinating the active people. The shopkeeper, the
young, healthy person.
The young, healthy person.
The spreader.
Right, the frat boy who isn't going to stay home, vaccinate him. You're not vaccinating people to protect them. You're vaccinating people to protect other people from them. And that turns out in our computer model, you got a lot more bang for your buck. I mean, you wanted to vaccinate everybody, but if you couldn't vaccinate everybody, you wanted to focus on the active first. And
Which is totally counterintuitive, maybe.
Yeah. And we ended up doing some of that, right? We prioritized first responders, school teachers, people who necessarily had, but we didn't do. I think we probably should have prioritized grocery store workers, retail workers who had to go in. Shops that couldn't close. Those retail workers should have been very high priority. So we got some traction in the U.S. I think it did influence what we did. I had a friend at the university in Peru where they were struggling with really limited supplies,
very short supply,
and they did take this. I think it saved a lot of lives in Peru. This analysis.
So there you go. I want people to understand this. This is not some pie in the sky policy stuff. This affects our lives profoundly.
Yeah.
So you made a difference in Peru. Now, here in the United States, you didn't get much traction. Did you publish an article in the Detroit Free Press or something?
We did. We did a thing in Detroit. Yeah, Detroit was interesting in that there was a big racial disparity in who was getting sick and who was dying in Detroit.
Was it higher in African Americans?
Higher in African Americans, and it wasn't entirely clear exactly why. And I had hoped to do a follow-up study. I could get the data for Detroit, and I really wanted to do a follow-up study to try to understand better why. It seemed likely to me, but I wasn't able to test this, so I can't say with any definitively that a lot of Black people in Detroit had jobs that involved public contact, and even, of course, the Black people in Detroit who didn't have that kind of job, people who had, a think tank job like me, their family, their relatives, their friends did. And so the
network here.
The network was just a lot more public facing. And that, I think, is the reason why the disease was so much more widespread in the Black population in Detroit than it was in the white population.
Fascinating.
But that's just a hypothesis that I wasn't able to test, which was unfortunate.
Sure. So when we were short on vaccine, we could, in retrospect, and once again, it was new for everybody. We were all scared. We won't talk about government dysfunction. I'm just going to leave that alone.
Yeah.
It might have been smarter to vaccinate the forward-leaning people, the people with face time.
And we did do some of that. I mean, we really did do some of that. And I think that made a difference. So I don't think our response was terrible, but I mean, you could always optimize it in hindsight.
Yeah, but I'm sure we could go on forever, Tim. But there's just one more thing I want to talk about, where law and policy meet the road, where a think tank and a person and a team with your experience are very, very valuable. And once again, tell me if I'm wrong, but I believe the government told hospitals, if somebody comes in with COVID and they're sick, take care of them, give them the care. We'll pay you back later.
That's right.
In plain English, that's kind of what happened. So hospitals, and I got to tell our audience that all but the biggest hospitals are under incredible financial stress. Rural hospitals are closing everywhere. People out in the country have to go farther and farther to get any kind of a hospital care or medical care. So you already take a strapped, stressed system,
Yeah.
and all these sick, dying people with huge intensive care and other high-cost medical needs. You can crush a hospital that way. You can crush a network with that. So the policy was, or the thought was, or the people said, and maybe you can help me with this, that we're going to pay you back for this care.
Yep.
Right?
Yep. So that ran. There were a few different agencies, but the program I'm most familiar with was the Federal Emergency Management Agency,
FEMA.
FEMA said, we have a public assistance program. You spend money on this disaster, we'll reimburse you.
Makes sense.
And a lot of the medical establishment, I mean, doctors really care about people's health, you know.
They really
the medical establishment rose to the challenge, and people were not being turned away for COVID. Because, of course, you can't have sick people wandering around the street. You want to isolate them. I mean, it was important. You're managing a pandemic. You want to get people treated and isolated as best you can. So they had this big response. FEMA said, yeah, we'll cover it. Well, the details of covering it are challenging.
What does that mean?
In most disasters, you can say, well, you know, this bridge was washed out. We need to replace the bridge. Okay. You know, okay, my roof got blown off. Okay, we know how that works. Hospital finance turns out complicated. I mean, it's not the money coming in and the cost going out are not related in any very simple way. Also, an important part of the Stafford Act that set up FEMA, it's illegal for the government to reimburse a cost that has already been reimbursed by someone else. And the problem is these people coming in for COVID treatment, some of them had insurance.
Some of them had Medicare,
some
or
had
whatever.
Medicare or private insurance, or the state had a program that was covering things. And so some of those COVID costs have already been reimbursed, but some of them haven't.
Oh my goodness.
Well, trying to chase that through and figure out, okay, the hospital spent $150 million. Also, like nurses were burning out, were getting, you needed more nurses, you had less nurses, there was more risk involved in the job. The cost of nursing went way up. You had all these people going through contract. What used to be a $35 an hour person became a $150 an hour person. Same person.
Wow.
Suddenly cost 4 or 5 times as much. Well, that's a fair extra cost that FEMA was prepared to reimburse.
Okay.
Not the $35 the nurse would have cost. That $35 for a nurse is what you were paying, but now there's an additional $105. FEMA will pay that part, but not the $35 that you would have paid normally. So trying to untangle all this stuff, very, very messy. And so actually I'm spending 60% of my time right now leading a team that's doing a part of this analysis. FEMA came to us and said, this is too complicated. Yeah, we've got people who understand flooding and stuff, but we need people who understand accounting, who understand medical billing, who understand all this stuff. So we were like, yeah, we can put together a team of people that does that. So I actually manage a team of about 15 people that have more experience with medical billing and stuff. And our job is to we've developed a standard method for looking at the hospital's books and saying, well, this is the kind of the maximum amount that could be reimbursed before it would clearly be duplicative. So that's something we can give them a number. But if they don't like that number, they're allowed to come up with their own method for accounting for duplication of benefits. And so they will give us some bunch of spreadsheets and documents, this generally a big messy bunch of stuff. And we need to go through and say, is this reasonable? And it's really important on both sides because first of all, we need hospitals, particularly rural hospitals. We need the U.S. medical infrastructure to remain healthy. That's critical. And the most vulnerable places are the ones we kind of most need to remain healthy. Usually they're kind of the last line of defense in a place. And we also need the U.S. medical establishment to believe that when the government says, look, treat people, we'll make you whole, they need to know that that's true. Because in the next pandemic, we don't want hospitals saying, no, we're not going to do that. We can't afford.
Right.
We need the establishment to be able to answer, to respond. On the other hand, this is big money. These are your tax dollars, and they're not, tax dollars. This money doesn't come from nowhere. It comes from you, from me, this is all money we could spend on educating kids, on, there's all kinds of other stuff we could do with this money, and to have it go to a hospital that's making a profit already, just so that their executives can get paid more, would be a travesty.
Right.
So we have to get this right.
So you have to be the stewardship and fiduciary responsibility here.
And so we take this really seriously, and we are processing these claims, and FEMA makes the ultimate decision, but we analyze this mountain of documents and give them a very concise memo. This is how we read it. What the hospital's done here is unreasonable for these reasons. Here's what they need to do to fix it. Or what they're asking for is reasonable. Yeah, you can go ahead and reimburse this.
Wow. So I hope that really brings it home that think tanks, expertise is crucial for the well-functioning of our society and government.
Yeah, and the thing I want to make sure to mention is that we are really, really careful about our reputation as nonpartisan analysts.
So when you get a report from Rand, it's not like from Cato.
It's not from Cato. That's right. And there's nothing wrong with Cato. I mean, it's important. Cato's an important thing.
The
Liberty
for liberty
needs to get translated into policy, and I may or may not like the policy, but somebody's got to actually figure out how to do that. So nothing against these other kind of think tanks. They're fine. But yeah, our stuff is respected by Democrats, by Republicans. We work largely for the military. The military brass treats Rand reports as the gold standard in analysis. Everyone who works there has a political opinion. And a lot of people, a lot of people with PhDs are going to look like professors anywhere. They're going to be a little on the left, but there are some that aren't. They aren't at a university because they're more on the right. We've got a lot of retired military that go both ways. Some of them are going to be quite conservative. Surprising how many people coming out of the military are actually quite moderate. But we have a real mix of views. But we have a big quality assurance process where when you finish writing the report, a senior person or a couple of senior people read it and scrub it for anything that smacks of bias.
Gotcha.
And so by the time a report comes out of Rand, you can't tell who wrote it. You have no idea the political leanings of the person who wrote it. And we all know that we have biases, but we just go to great length to check those biases to make sure that what we're doing is based in fact, based in analysis. We say what the methods are. We follow the method. We take that where it goes. And that's sometimes difficult. Sometimes there's an opinion you have that you think is really important and you really want to put it in there. You don't put it in there. This is what can we know?
Is objective. There was an old TV show, Dragnet.
That's right. Just the facts, man.
Just the facts, man. Just the facts.
That's right. That's really what we're trying to do. And I think given that our reputation is really good on both sides of the aisle, I think we're largely successful with that. And it took some getting used to, coming out of a university environment where that wasn't, good science is always good science. It shouldn't have a political aspect, but to have it be the main thing you're trying to do is maintain nonpartisan credibility took a little getting used to, but I've come to really, really appreciate it. I think you have more impact when you can say, this is exactly what I did. This is where the numbers took me, or we did surveys, and we involve all the stakeholders. We try to really take all the perspectives into account. But having something that you can say, this isn't just my opinion. I know exactly why we said this. That tends to have more influence. And when you can appeal in a polarized environment like today, when you can actually have both sides of the aisle reading your report and saying, okay, this looks like good stuff, that feels pretty good.
Yeah, and in the medical world, reputation is priceless.
That's right.
It takes years and years to develop, and you can crash it in an instant.
Yeah. Now, there's been some controversy around AI policy. That's something that we're getting into a lot, and we're still struggling with exactly how to come at the whole. What are the right questions about AI? But we're working through those, and we're going to be at the forefront of advising Yeah, do you regulate this? Do you not regulate it? Is it anybody's business? Is it dangerous? Is it dangerous? It's a real challenge. But
It may be the most important question of our time.
it may be. I mean, is AI has superhuman intelligence, is that an existential threat? No,
Is it Skynet? Yeah, I know. Everybody
my
keeps
guess
saying
is-
Terminator.
My guess is it's probably not, but it might be. But that's not a Rand report. We need to figure out, okay, how do we study this? How do we actually, and we probably don't come up with a definitive answer, but how do we really frame this in a way that's actionable?
Yeah.
That's the current challenge. And to that end, we're doing work with it. I've written something that can go through all of everything Rand has ever published and write a literature review of what Rand has had to say on any given issue using modern AI technology. That's the kind of thing that we do. And we're doing this in part just to become experts. We need to really know how it works before we advise the government on how to regulate it. So we're in this phase right now of trying to get smart on it so that we can actually say, not just offer opinions, but offer, objective facts based on how it really works.
Cutting edge
Stuff. And that requires, you got to get somewhere close to the cutting edge before you can comment on the cutting edge.
and add value. Yeah. Well,
Current challenge.
in the medical world, turns out AI is very good at diagnosing and whatnot. It's not perfect.
But neither are doctors.
Right, neither are doctors. And like self-driving cars. Well, maybe they make an error, but they're never getting drunk and they're never getting tired.
That's right.
And maybe in balance, yeah.
It's
no road rage and
no road
self-driver.
rage and a self-driver. But on the other hand, they do make mistakes a human wouldn't make. They don't make mistakes a human would make. Is the standard, if the self-driver is on average going to have fewer accidents than a human, then it's good? Well, people aren't satisfied with that.
Yeah.
Humans make a lot of mistakes. I mean, we have 3,000 people a year are killed in traffic accidents.
Right.
Well, if we have robots killing 30,000 people a year, that's unacceptable.
Right.
At least when somebody gets drunk and crashes into somebody, that it's their fault.
Right.
There's an ethical. So it's like, okay, what is the standard? How safe does a car have to be before you let it on the road? And boy, that's hard. And Rand has published some things on that. Although the upshot of a couple of them that I know offhand is, this is a very hard decision. People think it's easy, and it's not easy.
So I think you've got job security there, Tim. The never-ending flow of very difficult questions and always a need for experts to give us guidance. So, Tim, I want to thank you for your time. I want to thank you for everything over the years. Thank you for what you shared with me, non-classified.
That's right.
And I wish you all the best in years to come.
Thanks a lot. I look forward to skiing with you.